Get started. I'd like to thank everybody for coming today. Just want to introduce our speaker and talk a little bit about our group. So our talk today is being sponsored by the Medical Students for Life of America. This is a national network of future medical professionals committed to improving quality healthcare by defending conscious rights and the dignity of every human life. So our speaker today is Dr. Toffler. Dr. Toffler has been with the Department of Family Medicine at Oregon Health Science University since 1985 and serves as the Director of Pre-Doctoral Education. He is the co-founder and National Director of Physicians for Compassionate Care Education Foundation, a nonprofit organization that promotes compassionate care for severely ill patients without sanctioning or assisting their suicide. PCCEF physicians affirm an ethic based on the principle that all human life is inherently of value and that the physician's roles are to heal illness, alleviate suffering, and provide comfort for the sick and dying. He is committed to defending the long-standing medical prohibition against doing harm and has worked actively to support human life from conception to natural death. He is frequently invited to speak about these and other medical ethical issues at both regional and national conferences. Dr. Toffler has been a member of the Focus on the Family Physicians Council for the past 6 years. Dr. Toffler.
Okay, thanks. Well, it was a delight to be here with you, and I mean that very sincerely. This is actually only my second trip to Dartmouth. I've actually had the privilege of being here once before in New Hampshire several times because I was working with one of your faculty members, Dr. Leslie Fall, in pediatrics in developing cases for MedU University. And I don't know if all of you are familiar with them. How many of you are here beyond second year? So a few of you are. So you're familiar with the CLIP cases that were developed actually right here. And we actually stole your good idea, and we have FM cases for those in family medicine. And I actually got roped into that because I've been writing national board questions for the national board for the past 5 years. So those of you who are first and second year students may be subjected to some of the questions I wrote in behavioral science. I probably wrote 300 questions over the last 5 years. I have been in practice for over 30 years. I finished residency on the East Coast, even though I'm now on the left coast, but I originally started out at the Medical College of Virginia in Richmond, and then I went and did my training and residency at the Medical University of South Carolina, and then I practiced in the foothills of the Cascades in Oregon for 6 years. I practiced in a small town 14 miles from the nearest hospital. Before cell phones, we had these clunky two-way radios that got patched in from a transmitter on the mountaintop to have to talk to people on the phone when taking a call, and you'd have to say over in between statements and teach your patient to do the same thing. But it was a really wonderful experience of practicing the full breadth of medicine, and I still do that. Even at the university, I practice half-time. The other half-time, I'm administrating. I'm a PI on one of the behavioral science grants from the NIH. I also teach medical students as my primary responsibility, so it's particularly endearing to be among the people I work most closely with, that is you all, the medical students. We've been able to reform our curriculum a little bit better. I was talking with Aaron, and I understand you all have afternoon classes. Is that correct? And we're able to free that up and get a preceptorship every week, not just every other week. And so we've been able to do some very innovative things. But the outset is not to talk about you in general about me. I just want to give you a background that I've been immersed and meshed, if you will, in medical education for years. And some of the things I'm going to say are very different than what I might have said to you at the beginning of my career. And I'm going to go back there a little bit just for you to understand that I'm not coming at this from an ideological point of view that I've always held. In fact, I've been, as I look back on it, quite confused in my life about the boundaries that I chose for myself in my practice. And that's part of my goal today, is to share that with you so you can discern, as young adults, young physicians in training, about what boundaries you set for yourself. Because all I can do is to share my experience, and you're going to have to make up the choice for yourself. I'm also going to start with a preamble that I use with my small groups, because I teach in small groups every quarter, just like I have one now I'm going to miss today in the afternoon, and someone's filling in for me. But when I started the group this year, I said, I know you all come here with life experiences. Some of you have been out of undergraduate for 10 years. Some of you have PhDs, MAs. You have rich life experiences and skills. And you have made up your mind in some cases about some issues. And I tell my small group that I want them to suspend that enough to listen well to their colleagues, to your peers. And I write letters of recommendation. It's okay to disagree with me. I don't want you to be a little clone of Dr. Toffler. I want you to use your own gifts and talents and come to the conclusions you want. But I want you to be respectful of me as a minority view on some issues, a majority on others. I want you to be respectful of your colleagues as well. Because if I write the letter of recommendation, even if you're somebody like there's a person in my group or one of the group that I taught in my third year clerkship just last rotation who clearly disagreed with me about some things, but I'm giving her a 9 or a 10 on the scale of 10 when I fill out her evaluation. And she knew that because I gave her permission to disagree with me. Follow me? Now, on the other hand, if you close your mind and I see that in your behavior, you wouldn't want me to write a letter of recommendation for you that said this individual is pretty closed-minded about issues we discussed. It wouldn't be very flattering advice. So I just say that as a preamble because I think it's very healthy that you have an eclectic group. You're striving to be more eclectic at the university. I know I've heard about that, about your admissions committee. And I'd like you to do that again, at least for the next 50 minutes, that you, as we talk and have Q&A and interaction about this topic, that you learn from each other, and I learn from you, okay? Is that fair? I'm going to begin at the beginning. In my medical school, I was raised with a faith background, and I had a kind of notion about some things were not really good things to cross. But in medical school, I pretty well had parked those belief systems by the door. In the third year rotation, I remember vividly, it was with one of my eager beaver classmates who liked to do procedures and was kind of a small, petite woman and would generally get people to agree to let her do things. And she had more deliveries and that kind of thing. But the two of us were on the rotation OB in the old East Hospital of MCV, Medical College, Virginia. And it was an indigent care place as opposed to the West Hospital, which was dichotomized into people who had insurance and coverage and the like. So this day we were assigned to a resident who was supposed to do second trimester abortions. There were saline abortions at that time where you basically, was not rocket science, but I'd never witnessed before, neither had my colleague, I'll call her Mary. So Mary and I were watching this thing and watched the resident go through the motions. He tapped out a fluid pocket. This is the days before ultrasound. And then we found a fluid pocket when he thought there was fluid there. He then took out a large ampule with a needle, numbed up the skin, and then went through this sterilized area and drew off some amniotic fluid. And then put 2 ampules of hypertonic saline in the amniotic sac. And that then causes a dehydration and irritant effect in the uterus, and within a matter of hours, day and a half, the woman will expel generally a dead fetus between her legs. This is like a 20-week, 24-week, that sort of thing. They were lined up like airplanes about to take off on a runway. I vividly remember. My ear beater colleague steps up and says, "Can I do one?" to the resident, who pauses for a moment and says, "Well, sure." And he leads her through the same steps, and I sit back and watch the same thing I just described to you. And they talk after the second one's done. There's still a third to be done. And I was standing back, a few feet back, as I recall. This is a curtained area where nobody's really in a private room. It's all different, walled off by flimsy curtains that are hanging down from these cables. And Mary then turns to me and said, "Bill, why don't you try one?" And I must have had 1,000 thoughts through my mind, at least a dozen, I'm sure, and said, well, you know, these people are going to have this done anyhow. I don't want to make a fuss. And I said yes. And I went ahead and did what I now look back and regret is one of the acts I'd like to have not ever done in my life. So I can't change that. I don't think I even talked about it for about 20 years. And it finally leaked out when I was talking about this issue with a group of people in a church. And I just said, you know, this is my lived experience. So I share that anecdote with you because there'll be boundaries in life. Some of you may be here and are really for the choice of abortion in whatever circumstances. And that's fair. There's a rationale for that. But you may feel that that's okay, but you don't want to do it. It's okay that somebody has this done and somebody else does it, but you don't want to do it. So how involved do you want to be? It's the question I'd leave with you. And if you don't do it, do you refer for it? And believe me, I'll just tell a little anecdote about that too, because at one point I was certainly not doing them, but I would refer for them. And I remember being called by somebody who had little, in retrospect, more clarity about the issue about this than I did. And she asked me if I was a pro-life doctor. And I said, well, yeah, I am. And well, what do you do if somebody comes and wants an abortion? I told her the steps I go through. I try to support the person. I hear what their needs are. I try to help her in whatever it is. I even said, you know, if she's persistent, I'll say I'll give away my services for free. I'll get you connected with, at that time, what were called crisis pregnancy centers. I now look back, they've changed the name because in reality, what's the crisis? You know? And so It's a perception when the words are powerful. But anyway, she persisted. She was a savvy person who thought this through, and obviously I hadn't. And she said, well, what if the person still persists? What do you do? And I got a little irritated at the time. Like dandruff's up on my neck, hair sticking up. I'm a physician. I'm a professional. And I have a right to tell people what to do. So I refer. And then she said, well, I'll never forget. Well, we don't consider somebody really pro-life if they refer for abortion. So I was tweaked. But here I'm sharing this anecdote 25-some years later, probably, because the very fact that she was willing to challenge me in my beliefs caused me to think about it. And I didn't change that day, but I did change, because now I don't do that anymore. Okay? Now some of you, I want to share another perception. Say, if you're talking about different things in our society, we have different viewpoints. Like most of you will counsel people about smoking, I think, right? What's your value with respect to smoking?
Bad.
Smoking bad, absolutely. Bright young man. So thank you. And it's bad. It's bad for you because it's associated with lung cancer, esophageal cancer, bladder cancer. There's a litany of things that are bad. And I take care of these people in my practice because I take care of people from conception to natural death. I have to say natural death in Oregon because we have assisted suicide, and I don't participate in that either. But that's an example. I mean, however you feel about this end of life, how do you feel about the other end of life? You have to look at what are your values. You have values. You have values about smoking. Your value, and I agree with it, is bad. It's a blight. Now, some of you are from North Carolina. I know you trained there and things like that. And that was a wonderful, noble profession at one time. But now we know better. And so we have to reconsider what used to be a noble profession that was embedded in many of our southern states. You follow me? Now, smoking is one of those things we have values about. How about drug use, street drugs, right? We just changed the policy in our clinic to be very stringent about things like urine drug streams and maximum doses of opioids, because the longest study in opioids, you know how long it is? Long-term opioids in non-terminal patients? It's less than 4 months. We have no data about giving huge doses of opioids, and yet we're blithely going down this path, and you see the complications. More people now in Oregon, the state of Oregon, are dying of opioid overdoses than traffic accidents. You follow me? So it's a very serious problem. So we have values about that. Do we have values about the number of sexual partners you have? Do we have values? I mean, do you? And so I look at this. Do you have a value about life? When does it begin for you in your frame of reference? And when doesn't it? Does it have to be blessed by passage to the vagina? Is that when life begins? If that's the case, what about C-sections? You follow me? So at some point you have to sort of say, look and check where are you drawing lines and boundaries, because at one time I was blind to this. You follow me? Okay, so I've gone through my experience in medical school. I've gone through people challenging me along the way. I've moved a long way away from where I was 10, 20, certainly 25 years ago. So what other boundaries do I have? Well, I remember going into a woman's room after she delivered a baby and talking to her about what she wanted to do because she'd signed up for a postpartum tubal ligation. Not a big deal. So I go in and talk to her. You sure you want to go through this? What are your options? She said, what other options do I have? I said, well, you don't have to make up your mind right now. You can do a laparoscopy 6 weeks later. In fact, you'll get out of the hospital faster if you don't do this procedure, because we often delay people about a day in our institution because some bumps them from the doing it that moment. That's the kind of thing that happens. And I don't know what option she went with, but she didn't have her tubal that day. I didn't think anything more of it until months later when someone who's a representative from our so-called Center for Ethics was coming to me to talk about this case. That I'd gone into somebody's room and made them not have a tubal ligation. I said, wait a minute. How can I make somebody not do something they want to do? This is America. I can go in and give them information, which is what I did. And I said, have you talked to the